There's several different types of imaging for the breast, including mammography, ultrasound, and MRI. Digital mammography is the most common form of breast imaging, and it uses low-dose X-rays to take images of the breast. Screening mammography is obtained of patients that have no symptoms and is performed on an annual basis. Diagnostic mammograms are performed on patients that have symptoms, including pain or a lump, as well as on patients that have an abnormality on the screening exam. A mammogram is truly the key to early detection of breast cancer. The Society of Breast Imaging and the American College of Radiology agree that at age 20, women should start performing monthly breast self-examinations. At age 40 and older, women with average risk of breast cancer should have an annual screening mammogram and a physician examination of the breasts. Women with higher risk should begin annual screening mammograms and physician examination of the breast by age 30. When a suspicious finding is either felt or seen on a screening mammogram, your doctor may request a breast ultrasound. Breast ultrasound uses sound waves to view the tissue inside the breast and is useful for distinguishing between solid masses and cysts, as well as evaluating for lumps that are felt by the patient or their doctor. Breast MRI uses magnetic energy and radio waves for obtaining detailed pictures of the breasts. Patients that may benefit from breast MRI include those patients that have high risk of developing breast cancer due to family history, those patients that have dense breasts on mammography that results in a slight increased risk of breast cancer, as well as those patients with breast implants that may need evaluation for implant rupture. The most common breast procedures are breast biopsy and cyst aspiration. Breast biopsies are obtained of solid masses or calcifications that are visualized on mammography or on ultrasound, and cyst aspirations are obtained of fluid-filled structures demonstrated on ultrasound. Breast abnormalities that require sampling are frequently found using screening mammography, and in many cases are found prior to the patient being able to feel the abnormality. Biopsies are performed using ultrasound, stereotactic biopsy, and MRI to guide a needle into the area of abnormality to obtain tissue. This tissue is looked at under the microscope by a pathologist to determine if cancer cells are present. Not all biopsies that are obtained reveal cancer. A biopsy is the only way to know for sure if a suspicious finding is breast cancer and is a crucial step in early detection of breast cancer when the chance of cure is the best. The goal of a biopsy is to obtain a sample of the breast tissue, not the entire suspicious finding. If cancer is found in the biopsy, then surgery will be performed to remove the cancerous tissue from the breast. Local anesthesia is administered in the skin and a tiny incision is made. Under ultrasound biopsy, the needle is passed through the incision and guided to the abnormality using ultrasound real time. Under stereotactic biopsy and MRI-guided biopsy, the patient is laying on their stomach and a computer targeting system is used to guide the needle next to the abnormality. Most biopsies can be completed in 1 hour or less, and the patient can resume normal activity the next day. During ultrasound-guided cyst aspiration, the patient lies on her back, local anesthesia is injected into the skin, and an ultrasound is used for guiding a needle through the skin into the cyst. The cyst is then aspirated or drained using a syringe. This procedure may be performed on patients that are symptomatic due to painful breast cysts, and it may also be performed on patients that have a suspicious finding on mammography. This procedure can be performed in 30 minutes or less, and patients can resume normal activity that day. Most hospitals and imaging centers should offer these diagnostic tests and interventional procedures. NORTHOAKS Health System is an accredited facility that offers all of these procedures.